And good afternoon. Welcome to Life Unrehearsed. My name's Matt Del Vecchio, specializing in life transitions, downsizing, in the senior living industry. Coming up on the show, the gaining popularity of artificial intelligence in clinical care. Is it helpful? Can it be harmful? And perhaps it can replace healthcare professionals. Well, we have a leading expert in the field to discuss this very hot topic. And on the second half of today's show, the Jacqueline Fisher legacy lives on through the Jacqueline Fisher Foundation. We're going to hear her inspirational story and how her family is giving back to many different causes. And we're going to have a spokesperson from La Rue des Femmes that will be talking about the recent opening of an outreach clinic for women in a state of homelessness. Well, I hope you're enjoying this weekend. A little bit of a wet weekend, a lot more rain coming our way, as you just heard from Tom Whalen. For the long-time listeners, you probably know that I'm a bit of a diehard Habs hockey fan. So I'm just wondering, is it wrong for me to be cheering on the Leafs? Boy, I caught myself last night. Tavares scored in overtime, and I jumped off the couch, and then I sat right back down and said, I felt a little guilty doing that. So text me. Is that right or wrong to be cheering on the Leafs? But good on them, and also good on the Oilers. They punched themselves into the next round of the playoffs. All right, really looking forward to our next guest to discuss artificial intelligence, or AI as it's known in clinical care. We have Dr. Melissa McCradden. She's the John and Melinda Thompson Director of Artificial Intelligence in Medicine for Sick Kids in Toronto. Dr. McCradden, welcome to Life Unrehearsed.
Thank you so much for having me on, Matt.
Well, thanks for joining me. Now, first thing, obviously, I have to ask, you're in Toronto, so are you a Leafs fan?
I am indeed. I was out last night celebrating the game. It was super exciting.
Well, good, and it's exciting. Made it through the first round in many, many years, I think 19 years, so nice for you guys to have something to celebrate. Well, thank you for joining me, Dr. McCradden, on this Sunday. Really an important topic that's gaining in popularity. First of all, can you describe your role as the Director of Artificial Intelligence in Medicine for Sick Kids in Toronto?
Yeah, absolutely. So I do a number of different things. One of them is I do research. So my research focuses on ethics of AI. So a lot of this might involve talking to patients, talking to their families, talking to clinicians about their values. Usually when we're talking about ethics, we're talking about different values. So some of my research explores that. I also advise on policy at the hospital, so providing guidance for clinicians, for scientists, for patients and families. And then I do education, so ethics education. I also do clinical consultation. So when there's specific cases or projects, people will come to me to ask for advice, usually pertaining to AI in healthcare.
Well, good on you. Good on Sick Kids for Toronto, in Toronto, about this role. This actual role of Director of Artificial Intelligence in medicine, because it's rare. There's not many of these roles. You're one of the first, from what I understand, in the country, and it will obviously be more popular. You mentioned you have some colleagues in Montreal when we were talking off air. I want to back it up a bit, though, Dr. McCradden. For some of us, just the word AI, artificial intelligence, we kind of know it, kind of hear it, and more on the news. Can you, in briefly, in layman's terms, what is artificial intelligence?
Yeah, absolutely. So the thing to know about AI is that it's about patterns. So when we're talking about AI, we have a computer-based system that's looking at different patterns that happen. So, if you use Siri, there's patterns between particular words that you use and the kind of search results that people find helpful. If you're looking at Netflix, there's patterns between what people like to watch and other shows that similar people like to watch. And actually, if you're talking about sports as well, there's certain patterns that we see, with how certain teams perform under specific conditions, the probabilities and things like that. But we also know that these patterns, they can be super helpful, but sometimes we defy the patterns like the Leafs did last night, in fact.
Nice segue. I love that. And we're listening to Life Unrehearsed. Matt Del Vecchio here. We're talking with Dr. Melissa McCradden about the growing popularity of AI in clinical care. There are pros and cons, as you've discussed, Dr. McCradden. Let's start with how AI can play a positive role specifically in clinical care.
Yeah, so one of the most common applications of AI is in radiology So in the field of healthcare that looks at images, and so one of the things that we see with AI is that it's really good at finding patterns in those images. And so if you're a radiologist, you might need to look through lots and lots and lots of scans of a particular, part of a person's body or their whole body, and you need to zero in on which scans are the most relevant to that individual. And so that's one of the areas that AI has been really helpful, because it goes through all of those scans and it can pull up the ones that are most important for that radiologist. The other kind of category where there's a lot of benefit that we see is trying to alert clinicians to a patient who might be heading for trouble. So, for example, in the intensive care unit, a lot of what we're working on is trying to find ways to alert the clinician to the right patient at the right time to enable a just-in-time intervention to help them do better.
Some really good examples there, Dr. McCradden, and I love the radiology. I mean, if I'm hearing you correctly, radiologists, they could have dozens and dozens, if not hundreds of scans to go through, and AI may be able to pick up some things that perhaps a radiologist might not have picked it up, or at the very least, here's a red flag, Mr. or Mrs. Radiologist, and let's take a harder look at this one.
Yeah, that's right. And one of the things it can do is help triage. So some of the examples that we see where it's really helpful is if you, again, you might be a radiologist who's got a big workflow of, dozens and dozens of patients, an AI system operating in the background can pull up the one that might be most at risk so that the radiologist can look at that one first. And then there's other examples where it can help with the diagnostic process. So you always need the expert radiologist to look at this, and most of the studies show that when you have AI plus radiologists, you get better results than either one alone. Interesting.
1-2 punch, and at the end of the day, better for the patient. So those are a couple of very good examples of where AI helps. We do hear a lot about the risks of AI, particularly in clinical care. So what would some of those risks be?
Yeah, so AI makes mistakes that humans don't always make. There is a pretty famous example a while back of a computer that went on Jeopardy, actually, and it was the famous "What is Toronto" example, where it pulled up a really random answer in the context of doing incredibly well on Jeopardy for a long time. And we still see results like that in healthcare. So that can happen when a patient maybe doesn't fit the trends that have been the trends of the algorithm before. They might be a little bit different in some way. You can also have errors when a person might be putting in, triage notes, for example. Sometimes if you get the weight wrong, you have the decimal in the wrong place, it can result in the computer making an error. So when we have a human who's looking over these, they can typically catch those kinds of mistakes. And it's important to know that no model is perfect. Again, because we're looking at patterns can be really reliable for a lot of things, but not all patients fit the patterns all the time. And so we always need to be paying attention. Mm-hmm. One of the other risks that has come up is that because we're looking at a system that is, overworked, there's a lot of demand on clinicians, we worry about losing that human connection. And so a lot of my work actually focuses on how do we get the best out of machines and people, making sure that human connection that really draws doctors to medicine, and it's what makes patients feel the most respected and heard. How do we maintain that with AI?
Talking with Dr. Melissa McCradden about the growing popularity of artificial intelligence in clinical care. We have to head out to traffic, Dr. McCradden, but we want to have, we're going to take out the crystal ball. In your opinion, this is your field, where you think AI will be going in terms of clinical care. And I also want to talk about the fact that there are kids, adult children that know a heck of a lot more than AI than even their parents, and the parents are bringing them into appointments, and the kids may know even more. So we're going to ask you to demystify AI for some parents out there that may be bringing their children in, and maybe what questions they can ask on their behalf. And welcome back to Life Unrehearsed. I'm Matt Delvecchio, and we're talking with Dr. Melissa McCradden about the growing popularity of artificial intelligence in clinical care. Dr. McCradden, just before traffic, we said that we're going to ask you to take out the crystal ball. AI is developing so fast and rapidly. Where do you see AI going in terms of clinical care?
Yeah, I think that we're starting to understand better that AI is part of a whole system. That when we get all the pieces of the system right, together that's how we improve care. And so we see a lot of people who are working on understanding, what's the best spot in the clinical pathway for this, how's the best way that we can communicate this, and how do we bring patients into the design process so that we can really make sure that these tools are going to have a positive impact in healthcare.
Yeah, and I think that's exactly what people are hoping for. We want to have that positive impact. There is some negative sentiment out there, but you gave some wonderful examples beforehand, and AI can really it's fascinating, really, about how it can help all of us, not just the medical professionals, but us as patients as well, and parents. And that's one thing I want to talk to you about, Dr. McCradden. The younger generation can feel more comfortable than the older generation with AI, and in fact, children may know more than their parents. And as parents, perhaps it can feel a little daunting and intimidating. So I'd like you to demystify AI a little bit from a parental perspective, Dr. McCradden. What questions can we ask medical professionals concerning AI?
Yeah, I think it's important to kind of point out that right now, we don't have enough evidence to say, AI is always better. And I think in some ways, because we've called it artificial intelligence, it seems really intimidating. But it's actually not. If you think about it the way that you think about other sorts of computer programs or systems that you work with, it's a little bit less intimidating. And so the three questions that I would suggest people kind of think about is, first of all, you can ask if your doctor is using an AI tool to help with their judgment. And you can ask them about their experience. So how long have you been working with it? Was it tested on patients like me? Has it, gotten regulatory approval? Questions like that. You can ask, what would your decision have been if you hadn't had this AI system? And you can ask them about what their overall judgment is. So thinking about the AI tool, but thinking about other things that the doctor may have learned about you as a patient. What's their overall recommendation with and without AI?
Love those questions. Really good. And I think it's a great example of what you're describing as AI combined with the medical professionals can absolutely be a benefit for everyone. And it's responsible to ask these questions. And I love that question is, what if AI wasn't there? What would your recommendation have been? And I think it just leads to the fact that, okay, if it wasn't there, here's my opinion. But with AI as input, maybe the outcome might be a little bit different. And that also relates to how future appointments will go with doctors and medical professionals, where even just a year ago, AI not even on the radar for many, many people. So while we have you here, Dr. McCradden, I'd like to take advantage of your knowledge. One of the first positions of Director of Artificial Intelligence in Medicine, and you are at the Sick Kids in Toronto, and good on Sick Kids in Toronto for making this position available, and there's probably going to be more of them right across the country. So I want to ask you about some large language models, I guess is how it's referred to, such as ChatGPT. Many people are hearing about ChatGPT becoming extremely popular. What do we need to know about these large language models?
Yeah, so again, like other AI models, like other computer systems, they work by patterns. So if you think about when you're texting somebody or writing an email, the word predictions for what's the most likely word that's coming next, ChatGPT actually works really similarly to that. So it's predicting a plausible sounding response based on, learning from many, many different examples that are across the internet.
Yeah, and internet, I think, is a key here because it's learning from the internet, which brings me to my next question. And you're listening to Life Unrehearsed. Matt Del Vecchio here, and we're talking with Dr. Melissa McCradden about the growing popularity of AI in clinical care. And that buzzword, ChatGPT is relying on internet. So that's kind of the source of information. So do you see that improvements might be able to be made, Dr. McCradden, with ChatGPT, for example, from a medical perspective?
Yeah, I can see it being helpful in certain ways because one of the things about it is that it can give you sources of information that with expert guidance can be reliable. I mean, one of the main challenges with it right now is that because it sounds plausible, it's really convincing. But we actually don't know specifically what the patterns were that ChatGPT learned and other language models. And so we don't know if that output that's coming to you is the result of, high quality websites like About Sick Kids Health, Mayo Clinic, other kinds of places like that, or whether it's, less reputable sources. And so some people can get a really reliable output that would be better than if they had done a search themselves, potentially. But other people might get an actually very bad opinion coming out of it. And one of the challenges of being, if you're the patient, because you don't have that expert knowledge, you're asking because you don't have it. And so it's hard to evaluate how much you should rely on that output. And so I think what we need to do a bit more of, again, is think about how might this fit into a workflow where you have that expert guidance that comes to the patient that helps the patient make a good decision based on the output of something like ChatGPT.
Very interesting. And I guess I'd like to ask you as we wrap up here, Dr. McCradden, and I want to make our listeners aware that your background and your focus is on ethics. So you're not necessarily pro AI. You're not necessarily against AI. So now I'm going to put you on the spot as a parent and bringing in a child. And you mentioned that although you are at the Sick Kids in Toronto, you have some colleagues, for example, at St. Justin's and right across the country. So as a parent, should I be comfortable? Would it be the right thing to try to get some AI support with the medical professional to get the best diagnosis possible, or are we just not there yet?
I think it depends on the system, actually, because there's some that are really reliable that I'd be entirely comfortable, having them used as part of how, care is delivered to my child. And so that's why I think it's so important for people to feel empowered to ask those questions about the particular system that they're working with. And then always to remember, the standard here in Canada is shared decision-making. And so that means as a parent, as a caregiver, as a patient, your values matter. And we respect that so much in medical care. And so always kind of hold on to that, because it's not just about what the AI says. It's also not just about what the doctor says. It's about how those values work together to try and find the best path for that specific patient.
It's so true. At the end of the day, you're just worried about your loved one and you want the best possible outcome. Dr. McCradden, we're definitely going to have you back on the show, because this is a field that's developing so quick. And good on you, by the way. You're one of the leaders in the country on this with a young family yourself, and I only wish you much success, and would love to tap into the latest knowledge later on this year during the show.
Great. Thank you so much for the invitation.
All right. That's Dr. Melissa McCradden. She's the John and Melinda Thompson Director of Artificial Intelligence in Medicine for Sick Kids in Toronto. Wonderful and fascinating, and more coming our way.